Hello, and welcome to your ORTC training in partnership with R1 Discover on pulling the golden thread. In this training, you will become familiar with the concept of the golden thread in tracer methodology and how we can sew R1 Discover into our treatment plans and integrate the decks and assignments fully into our treatment program and patient records. Imagine that you are reviewing a chart on a client who is established in treatment but new to you. You open a session note and the plan builds off the discussion in the data section. The data section relates directly to the objectives in the treatment plan, and the treatment plan was developed using a tool that is mentioned in all three locations. This is the golden thread. When a chart reads backwards as well as it reads forwards, we know where the client came from and we know where they are going next. The more specific we are with our objectives and interventions, the more opportunity there is to give directed care and purposeful sessions. Not only do regulatory bodies like the State and Joint Commission look for the golden thread using a thing called tracer methodology in our licensing and certification audits, but insurance agencies look for adherence to a treatment plan in session notes to determine if the service is billable. Being specific in our objectives lends us the ability to ensure continuity in services no matter which provider is administering the service. R1 Discover cards can be used at any stage of change, in any phase of addiction, and can be used to assist clients in mapping out a path out of addiction, identify patterns in relapse, identify motivation and barriers, as well as to identify skills and strengths clients can use towards their recovery. When treatment planning, we can utilize the list of decks, activities, and worksheets or handouts that may benefit the client in addressing their unique goals and needs. R1 Discover assignments completed in or between sessions can be uploaded into the client record for counselor to review and make notes on. Counselor can use the completion of assignments in the data section of the note to follow up on the previous session's plan and to identify an objective from the treatment plan as being completed. Counselor can then use this in their assessment in the note, identifying adherence to treatment plan and identifying whether the treatment plan remains appropriate. In the case of stages of change and phases of addiction, this is quality information to go into the assessment section of a DAP note and a great measurement tool for use in developing a baseline and a measurement of progress in treatment planning, i.e., client is equally in the rehabilitation phase and the recovery phase. Client would like to move further into the recovery phase. The data section of a DAP note should clearly identify the services provided and should not be a scripted narrative of the conversation that took place, but instead have key insights into where the client was in treatment last session, progress they have made on their goals and objectives, interventions used by counselor, and client's response to these interventions. R1 Discover tools give us several of those components that are easily interpreted, easily documented, and give sustenance not only to our sessions, but also our documentation. The struggle to find interventions and activities to work on with stable clients is a universal truth in the OTP world, but R1 Discover can be used even with the most stable clients to improve the service delivery to even our most stable long-term clients. Whether a client completes a deck in office or online between sessions, the completion of the deck does not end the exploration of the deck. Clients can be assigned to watch videos between sessions or to complete worksheets related to the card deck and activities related to the R1 Discover deck identified in their treatment plan goals and objectives. These worksheets can be used in combination with clinical skills, such as motivational interviewing, to assist clients in gaining greater insight into their patterns of behavior and to elicit motivation to move forward with treatment plan goals. The assessment section of ADAPT Note gives us insight into the client's progress in treatment and in their personal goals. This is a tool counselors can use to track progress and also to determine the most appropriate interventions by evaluating client stage of change, motivation, locus of change, phase of addiction, etc. The more accurate we are in our assessment, the greater chance we have of matching the client with the appropriate interventions, and the more detailed our plan can be for our next session. The use of tools such as R1 Discover in the treatment planning and service delivery ensures that clients are receiving directed, comprehensive, and quality care that is individualized to their specific needs and stages, tying the golden thread throughout the continuum of care.